Hello everyone, I'd like to welcome you all to this online lecture. We're discussing common pediatric GI disorders. I'm Dr. Marwa T Eldeeb, an Associate Professor of Pediatric Gastroenterology, Faculty of Medicine, Ain Shams University. Hopefully by the end of this lecture, we'll be able to identify the differences between gastroesophageal reflux and gastroesophageal reflux disease. We'll be able to clinically suspect celiac disease and to identify the main diagnostic tools and set up a management plan. Chronic constipation, why does it happen, the pathogenesis, and the lines of management. I will highlight the guideline for management of food allergy. And in all of these four items, we'll be able to do a solid history taking and examination skills required in diagnosing the above mentioned diseases. So are you all ready? Let's get started then. What do you think? How common is this scenario in the pediatric practice? You come to see a 3-month-old who's full-term infant with a complaint of spitting up multiple times a day. And you examine the infant and you see that he's growing well, his weight, his length, his overall growth is fine, and the physical examination is entirely normal. So here comes a different scenario. He's a 4-month-old infant, screaming most of the time, especially after being nursed, and he's losing weight. The mother keeps changing the formula and then uses another formula, and nothing seems to help. See how this scenario is different from the other one? So it's always the same question. Is 2D or not 2D? Is it gastroesophageal reflux or gastroesophageal reflux disease? And here's the difference in simple words. Gastroesophageal reflux, which is often referred to as infant regurgitation, becomes the more serious gastroesophageal reflux disease if the infant won't eat, stops gaining weight, vomits blood, and is extremely irritable. So it looks easy that we can clearly identify cases with gastroesophageal reflux and others with gastroesophageal reflux disease by doing a good history and clinical examination. So the question is, are diagnostic tests needed in cases of gastroesophageal reflux disease? Let me give you a clue here. If there are no warning symptoms or signs in the history or in the examination, and the clinical picture is classic of gastroesophageal reflux or gastroesophageal reflux disease, so there is no need to do any other sophisticated diagnostic test. So the question is, what are these warning symptoms and signs? So this is some work for you to do till we meet. This slide sums up the kind of tests that we might need to do in order to confirm the diagnosis. It includes an upper GI contrast radiography, collectively known as barium studies, and you'll be seeing some of them in the demonstration sessions. We can do upper endoscopy and take a biopsy to confirm the diagnosis. Sometimes we need to do monitoring of the pH of the lower end of the esophagus over 24 hours. This is known as esophageal pH metry, in order to identify the degree of reflux, the degree of the acidity of the lower end of the esophagus. And again, you'll be seeing some of these reports in the demonstration session. How to manage cases with gastroesophageal reflux or gastroesophageal reflux disease. The treatment options for cases of gastroesophageal reflux and gastroesophageal reflux disease has 3 pillars. The first is the lifestyle modifications, and this line of management usually shows a great degree of success in cases of infant regurgitation. We'll be discussing it in more details. The second is the pharmacological agents, including drugs that decrease or even abolish the secretion of HCl by the stomach, as the H2 blockers and the proton pump inhibitors. And finally is the surgical line of management, and sometimes we do resort to this line of management in a very selected patients.